Afternoon, friends. I'm Dr. Ramanjit Singh. I'm consultant dermatologist at Medanta Medicity Hospital and I'm director at Derco Skincare Clinic, Gurgaon. Today, I would like to talk something regarding photofacial. Photorejuvenation is the term of photofacial, where we use light technology, that is, we use a eye, and this beam helps in rejuvenation of skin, rejuvenation of face. It helps in lightening of skin, and thereby giving a tightening effect. IPL treatment is a wonderful alternative to normal facials that we have in the market, where we use a thick layer of gel. We apply it all over the face and we apply it on the neck, and then thereafter we pass laser beam light, which helps in removing the upper dead layer of the skin. So the dead layer of the skin, which is very fine, it sheds off gradually, thereby getting new cells from underneath. And it gives a lightening effect, it gives a tightening effect, it helps in reducing the pore size, it also helps in reducing the fine lines and wrinkles. It's a wonderful process which takes about 30 minutes time. It can be performed in the outpatient department, and immediately after the procedure, you can go for your work and do whatever. There is absolutely no downtime attached to it. There's no redness, no laser, post laser scars, no marks, nothing. So it is basically a anti-aging process, anti-aging laser process. So it definitely helps in reversing our aging process. It helps in reversal of aging by stimulating the collagen which is under the surface of the skin, thereby giving a tightening effect. It also helps in closing the pore size, thereby again giving a tightening effect. It helps in lightening the skin. It helps in removing the blotchiness of the skin and removal of the dyschromias. So it's very good process if done properly. Anybody is eligible to take a photofacial treatment, provided he doesn't have any previous history of skin allergies. Secondly, he should not be a very frequent outside worker, overexposure to sun. Then thirdly, he should not be on Roaccutane, that is oral isotretinoin drugs which some people take for treatment of acne. Those need to be stopped. He should not be on any topical tretinoin medication which helps in removing of the fine lines. So all these treatments have to be stopped before taking a laser photofacial. About 5 to 6 sittings of laser photofacials are definitely required to attain a good result, and they are spread at an interval of 2 to 3 weeks each day. Wonderful treatment. Immediately after treatment, you can go back to your work, and very first sitting also shows a good effect on your skin. So before going for photofacials, I advised you should not be too much overexposing yourself to outside climate. You should not be on Roaccutane or any other sensitive drugs, and you should not have any past history of any flakiness or skin irritation or atopy. So these things have to be overruled before going in for photofacials. Chemical peels and photofacial, it is difficult to compare both the treatments because both help in removing the upper layer of the skin. In chemical peels, we burn the upper layer of the skin, which is again done in a photofacial treatment also. But photofacial treatment, there is a very superficial damage to the stratum corneum. So there is no immediate redness on the skin. There is no burnings on the skin. There is no frosting on the skin like chemical peels. So it is different and certainly a better mode of treatment to have a rejuvenated skin. Before going in for photofacials, I asked you we have to stop all these medicines, what all are exfoliating drugs. Then at the same time, we have to clean our beard. If a male person is going for a photofacial, we have to clean our face, and we have to be very, very regular and particular in advising us sunscreens, which is required immediately after photofacials and post photofacial treatment also. Every 3 hourly, good sunscreen of the SPF of about not less than 35 to 40 is required. Laser photofacial is required if somebody has a damaged, photo damaged skin, if somebody has a aging skin, if somebody has hyperpigmentation on the skin, if there are a lot of open pores, if there are a lot of acne scars or any type of scars, we advise photofacial. At the same time, it is a wonderful treatment for treatment of rosacea. Rosacea is where we have a lot of redness on the face. So that is probably because of dilated blood vessels under the skin. So for that condition also, we require photofacial treatments. Laser photofacial, as I already told you, where we apply a thick layer of gel on the face, entire face and neck, and then we pass laser beam, thereby giving you a superficial exfoliation of the skin. So it's a good treatment. No side effects, absolutely, if done properly, if done in proper hands after proper training. Otherwise, at times, laser photofacial can definitely lead to burn scars, which are certainly again irreversible. Some amount of redness can occur immediately after photofacial, but for that we can definitely advise some amount of mild steroids, which can be used probably for a day or two, and thereafter absolutely nothing else is required except for the fact that sunscreens, regular and constant use of sunscreen is required. Thank you.